Welcome to the Wisteria Home Care Agency, training on identifying and reporting abuse, neglect, exploitation, and financial abuse. In this training, we will cover essential information to ensure our staff can recognize and appropriately address these critical issues. Understanding abuse, neglect, and exploitation is crucial in providing effective care. Let's begin with some key definitions. Domestic violence refers to the use of force or violence within the household or family that results in harm or abuse. Abuse. This involves harm in various forms, including physical, verbal, sexual, psychological, and emotional injury. Abuse is typically repetitive and escalating. Neglect. The failure to provide necessary care. It can be passive, unintentional, or active, intentional, leading to physical or emotional harm. Child neglect. Leaving a child in a harmful situation without arranging for necessary care, with an intent not to return. Exploitation. The misuse of a person's resources for personal gain without their informed consent. Wisteria Home Care Agency is committed to addressing these issues through comprehensive education and intervention strategies. 1. Education. Staff will be educated on identifying and assessing domestic violence, abuse, neglect, and exploitation. We provide training on appropriate interventions and recognizing populations at greatest risk. 2. Reporting and intervention. We follow current laws and regulations for reporting and intervention. We maintain a referral network with community agencies for victim support and care. 3. Documentation and monitoring. Proper documentation of assessments and care is mandatory. Screening guidelines are established to identify at-risk populations. 1. At-risk populations. Examples include infants and children, especially within welfare systems, women of all ages, pregnant women, and individuals with mental disorders or severe challenges, elderly requiring continuous care. 5. Quality assurance. All cases of abuse will be monitored and evaluated as part of our quality assurance activities. Reporting is a critical component in addressing abuse and neglect. Here's how we handle it. 1. Child abuse reporting. Report any suspected child abuse promptly to the Department of Health at 1-800-805-5556. Include all relevant details such as names, addresses, nature of the injuries, and identity of the perpetrator. 2. Reporting mechanisms. Suspected cases are referred to the agency administrator. The administrator or their designee will evaluate and refer cases to the appropriate child welfare office, ensuring follow-up and coordination. 3. Operating hours. Our 24/7 answering service ensures that reporting can occur at any time. Recognizing the signs of abuse and neglect is essential. Here are some key indicators. Primary detection, children. Symptoms like inadequate feeding, emotional deprivation, and poor parenting skills. Secondary detection, children. Definitive signs like multiple fractures, malnutrition, and indications of sexual abuse. Recording and reporting. Collect factual evidence and record observations accurately. Discuss findings with the family when appropriate. Education and training. New staff receive orientation on reporting responsibilities. Annual in-service training on identifying and reporting suspected abuse and neglect. Elder and disabled individuals are also at risk of abuse and neglect. Here's how we handle these cases. Reporting suspected cases are reported to administration for referral to the appropriate agency. Indicators. Look for physical indicators such as injuries incompatible with history, malnutrition, and signs of inappropriate medication administration. Psychological abuse. Be aware of threats, insults, and withholding of affection. Financial abuse. Signs include overdue bills and discrepancies between financial resources and personal care. Preventing and addressing theft and embezzlement is also critical. Procedure for reporting theft. Report any theft or embezzlement to a supervisor or manager immediately. The supervisor will then notify the administrator and prepare an incident report. Incident report include details on potential identity theft, fraudulent use of information, and any relevant contact information. Prevention measures, conduct employee pre-screening, frequent inventories, and control bookkeeping functions. At Wisteria Home Care Agency, our priority is ensuring a safe and respectful environment for all. By understanding and adhering to these policies, you play a vital role in protecting those we care for. Thank you for your attention and dedication to these important matters. If you have any questions or need further guidance, please reach out to your supervisor or the administrative team. This concludes our training. Keep up the excellent work and stay vigilant.